Hi everyone, welcome. Okay, we are going to go ahead and get started. So welcome to the Inova Peterson Life with Cancer Women's Sexual Health Series. My name is Jennifer Bires. I'm the Executive Director for Life with Cancer, but also a certified sex therapist. And I'm so excited to be here with you all for the second to last session of our Women's Sexual Health Series. And before we get started, I just wanted to share a little bit about the Peterson Life with Cancer program. This program, the Women's Sexual Health Series, has been funded by a really generous grant from the Cancer Action Coalition of Virginia and the Centers for Disease Control and Prevention. So we're really grateful for them supporting this program. Our series has been many months long, starting all the way back in January, talking about menopause, pelvic floor movement, the role of pelvic floor, mindfulness and sexual well-being, reinvigorating eroticism, an overview of women's sexual health, managing emotional distress, finding pleasure, treating sexual health concerns. Tonight, we're going to talk about couples and sexual health, and then we'll have our final part of the series June 3rd with sexual desire. And you can catch every single one of these presentations on our YouTube channel, and we'll send a link out to all of the participants after as well. All right, so Peterson Life with Cancer is part of the Inova Shar Cancer Center, and we are the psychosocial integrative educational arm of the Cancer Center, providing support to all individuals impacted by cancer from diagnosis through survivorship, through evidence-based holistic care at no cost, no matter where treatment is received. We welcome anyone to our programs. We, like I mentioned, they're no cost. We want to make sure that they're accessible. We have a number of online programs like this one, and then we are co-located in each of the Inova Shar Cancer Centers across Northern Virginia. And we have a really specialized and trained staff to provide services to patients, families, and our community. For those of you who are located in Northern Virginia, we do have a specialty shop at our Fairfax location that sells items that people may need based on their treatment, as well as a number of products to support people's sexual health needs during a cancer diagnosis. So please stop by if you're ever in the Fairfax area. All right, so we'll hold questions until the end just to make sure that we can get through the presentation. You can drop questions into the Q&A feature all along the presentation so that you don't forget them and that they're there waiting for me when we get there. Please feel free to use the chat feature to connect with one another. I'll also be asking some questions, and so you can put that in the chat. It helps build community and helps us get connected. And then if you can just rename yourself, if you have a different name than your normal name, that helps us keep track of attendance and know who's here. And then just a legal disclaimer that we want to make sure that folks know that this webinar is just for education. It's not to be used as medical device. We certainly hope that folks learn things that they can apply to their own situations, but really talking to your own provider or professional is really important as you decide to move forward with different pieces of care. All right, so very excited to be here today to talk really about one of my favorite topics, intimacy after cancer, specifically focusing on a guide for couples today. Intimacy is something that is so incredibly important to different relationships, but sexual health can oftentimes be something that's hard to talk about, we may not have practice with, and it can really impair getting back to sexual health that feels important. So my goal today really is to provide information, normalize folks' experiences, and offer some practical tools to help navigate these challenges. So today we're going to try to just briefly talk about the impact of cancer on intimacy. We'll cover some key areas that couples face when dealing with cancer's impact on intimacy. We're going to start by understanding how cancer affects relationships and sexual health, and then we'll move into that practical strategies category, as well as some exercises you can try together. Each section builds on the last, and we'll end with some resources that you can explore further after today. Esther Perel, one of my favorite relationship therapists and sex therapists, says engaging in eroticism enables us to maintain a sense of aliveness, vibrancy, and vitality. And certainly after a cancer diagnosis, feeling alive and feeling vibrant can be a really important part of coming back to yourself. Sexuality can really signify I'm alive, I'm human. It is an acceptance and validation by a partner, or can be an important piece of dating for some. And oftentimes I hear from patients that this idea of resuming sexual intimacy is a way to feel normal again, or feel that life has gotten back to a regular rhythm or cadence. And oftentimes it's not something that's always talked about at medical appointments, and it doesn't feel necessarily supported or something comfortable to talk about with friends and families. We know that being diagnosed with cancer is a life-altering experience, but we also know that it doesn't just impact your physical health, that it really can impact many pieces of your well-being. And it doesn't just impact the patient, it impacts our partners, it impacts your support system and community. And so when we think about the alteration of a cancer diagnosis, it really kind of touches every part of a person's life and of a caregiver or partner's life. When we think about sexual health in particular, cancer creates a ripple effect really through every aspect of life, including intimacy. So physically, treatments can cause fatigue, pain, direct changes to sexual function. Emotionally, you may experience anxiety, depression, changes to body image. Roles in relationships may shift. So perhaps one partner who was the primary caregiver is now receiving care, or the person receiving care can't do all the tasks in the house that they used to do before. And so all of these little shifts can change the dynamics of a relationship. And when the dynamics of a relationship change, they affect how you connect intimately. And while these are normal and expected, it's really important to make sure that there's the ability to talk about them and address them. I like this little graph because we like to say that good sexual health really happens right in the middle of this. And we say that to say it's complicated, which doesn't mean it's not worth working towards, but there's a lot of things that make up our sexual health. Our psychology, thinking about, performance anxiety, anxiety and depression, and how we're entering into a situation. But then there's the physical pieces, endocrine function, how you're feeling functionally, how your body is working. We have everything we come into a relationship with from our upbringing. So it may have been the way our parents talked about sex or didn't talk about sex. It may be how our religion teaches us about sex and what things are okay and not okay to try. It may be the culture or the community that we're involved in and how that impacts our relationship or our ability to engage in these conversations. And of course, in our personal things come into play, like the quality of your relationship, how sexual health was before you had a cancer diagnosis, and all kinds of other life stressors like financial well-being, kids in the house, you name it, it's a part of that. And so when we think about sexual health, it really is, it's complicated. There are things that like couples experience as a couple. And I want to emphasize that folks who are joining us today are really not alone in what you're experiencing. We run a support group for sexual health support group for women impacted by cancer. And people often come into that group and they go, oh, you're experiencing that too? You're experiencing that too? And so there's something that can feel really good about knowing that you're not alone in what you're experiencing. And especially with sexual health, I find that oftentimes couples think, we're the only couple who's experiencing this. All the other couples are doing okay. Because oftentimes couples aren't posting about their sexual health concerns on Facebook or Instagram, and they're not talking about them around the dinner table. And so I think the first thing that I just want to make sure that folks know is that you're not alone. This is really a very common concern in people and couples impacted by cancer. and that nearly all couples face decreases in desire after cancer. And this oftentimes affects both partners. Sometimes I think we say like, oh, it's the person with cancer that has less desire. And that may be true, but oftentimes both partners, just due to the stressors of a diagnosis, may have less desire than they had before. And many partners worry about causing pain or harm during physical intimacy. Both individuals may struggle with fears of rejection or abandonment. And many couples tell me we've stopped communicating about intimacy altogether, which just deepens that disconnection and creates, a bigger chasm between getting back to a good sexual health. And these are all really normal responses to a really abnormal situation. But I'm hoping after tonight, you'll realize that there are a lot of steps that you can take and tools that you can try that can be helpful in this journey. So we've had a number of presentations, and Dr. Rachel Rubin just spoke in our last education on some of the physical changes. But I just want to really quickly note that for women who've had cancer treatment, vaginal changes like dryness, pain, and narrowing are common. That can be due to surgery, radiation, or hormonal changes. The fatigue that comes along with a cancer diagnosis can oftentimes make sexual activity feel impossible or certainly get put onto the back burner. Surgical scars and body changes can affect how comfortable you feel being seen, and hormonal shifts from treatments can reduce desire and affect arousal. So I just note that the physical changes have been talked about with some ideas for techniques to try or interventions to try. So we're not going to spend a lot of time here, but this is a very real consideration and has a very real impact on sexual health and relationships. Also, couples experience the emotional impact of cancer, and this can be just as significant as some of those physical changes. When we think about body image concerns, that's nearly universal. This idea of feeling disconnected or betrayed by your body, a sense of identity might shift, and that can be for our partners and for folks who've been diagnosed with cancer. Intimate touch can trigger fears around recurrence or reminders of treatment. And there's really a lot of grief in losing certain aspects of your intimate life. And partners often feel helpless in this, really unsure how to respond. And that can really complicate things even further. And I want to make sure we talk about partners, because oftentimes in a lot of these conversations, partners are left out of the conversation. And I just want to take a moment to say, if there's any partners on the call, your experience is unique and equally valid. Many partners find themselves kind of caught between this idea of being a caregiver and being a romantic partner. And those roles can sometimes feel in conflict. As a partner and caregiver, you may be managing your own fears about reoccurrence while trying to put on a strong face. Many partners describe feelings of uncertainty. They're not quite sure how to initiate intimacy. They're afraid of being rejected, a fear that all of us have. They're afraid of causing pain. And oftentimes you may be suppressing your own needs to prioritize your partner's health. And so I just want to note that really in this conversation, your experience matters too. And really both partners being able to address their own unique needs as part of getting back to sexual health or enhancing sexual health is really key and important. I did want to note some of the common partner responses because there are some patterns that we may see in responses to cancer. Many times people will withdraw from physical intimacy. That's not always from a lack of desire, but oftentimes a fear of causing harm. For our partners on the call, you may find yourself, again, suppressing those emotions, which may make sense on some level, but also can lead to resentment over time if there's not the opportunity to really talk about how the cancer diagnosis is impacting you as well. And attraction can be complicated by the caregiver role. Partners and caregivers sometimes feel excluded from medical discussions about sexual health. don't always feel like it's their place to seek out support, or that talking about your own experience may diminish the patient's experience, or really getting into this idea of a fixing mode, finding fixes. And so really just this idea of creating patience and presence, both for partners and people with cancer, to have these conversations can be really important. I do want to mention grief, because grief can be such a large component of sexual health after a diagnosis for patients and partners. And the grief and loss of sexual health is oftentimes not looked at and not thought about. And while I feel really confident that each of you can get back to a really healthy, satisfying sex life, I also know that it likely may not look exactly as it looked before. And there needs to be time and acknowledgement to mourn some of those very real losses. Grief over sexual function, the way your body used to work, what sex looked like in your partnership before cancer, feels really essential to me before you can move forward and build something new. And grief isn't a process we get over. So it's not like you grieve something and then, oh, it's all better. Like grief is something that can come in waves, and it can get better, but come up again when something else changes. And it's something that we carry with us that goes through different levels of intensity. And grieving the loss of how your partnership has changed from a cancer diagnosis doesn't diminish gratitude for being alive. It doesn't mean that you're disappointed in the partnership. But it's important to create space for grief and even talk about it. So while today we're going to go over a lot of interventions, I just want to, we really want to create space for the grief that can come and the importance of making some space for it. We are going to talk about some communication strategies, and certainly that can be used when thinking about grief and talking about grief together. But don't race to making things without taking some time to really think about the losses and acknowledge them, because that is just as an important part of healing as moving forward is. So when we think about sexual health, good sexual health is really about adjusting to your current life stage. And while cancer may be the life stage right now, there are all times of life stages when we need to reassess our sexual health and maybe change those. Some of the more common ones could be parenthood, it could be aging, stress of a new job. All of those may mean that things have to be adjusted. And so when we really think about sexual health, it's this idea of being able to be flexible and adjust with some of those changes. It doesn't necessarily mean that you have to like the changes or get excited about them, but really that different tools may be needed to feel successful. I like to think of it, I'm getting older and I can't see as well, and I don't want to use glasses out in public. But I wouldn't say like, oh, I'm never going to use glasses. I'm just going to move through the world unable to see. And that's kind of not the same as sexual health, but this idea of the adaptations we make, like using glasses or like using mobility devices, can be helpful when we think about sexual health, because we don't want to just take it off the table. We want to think about how we can create adaptations within the limitations that are present. And that oftentimes may feel like all the responsibility is on the patient or all the responsibility is on the partner, but can work so much better when people come together to do that. So some of my core tenets, and one of the most helpful shifts couple can make, is really broadening your definition of intimacy and broadening your definition of sex. When we equate intimacy only with intercourse or only with penetration, only with orgasm, we really limit our options for connection. And that's especially true when penetration may be difficult or even impossible. So when we think about intimacy, we want to think about emotional closeness. We want to think about non-sexual touch as a tool, this idea of vulnerability, and the many, many forms of connection that exist. And this may be an opportunity as partners to really explore new ways of being intimate and to really focus on this idea of pleasure and what feels good rather than only focusing on performance or achieving a specific outcome like an orgasm. Oftentimes, one of the most important questions I ask people is, why do you want to have sex? And I don't know in all the couples I work with if anyone has ever said to me, because I want to orgasm. And I'm not saying people don't want to orgasm. Like, of course, that's something that's good and can be an important part. But most of the time, people say to me, like, I want to connect with my partner in this way. My partner is the only one I can do this with, and so it feels like an important part of something we have together. It's a part of my identity to be sexual. And so really thinking about the why behind why you want to have sex can help start to lay out a roadmap of what sex means, what intimacy means, and can help really identify some of the interventions that are going to be most helpful. Okay. All right. So physical interventions have been talked about in some of the other presentations, but quickly, lubricants and moisturizers are often a must. They can help address vaginal dryness. Making sure to understand the difference between the different lubricants and moisturizers can be really important, and that's certainly been covered in depth in some of the other presentations. Low-dose vaginal estrogen for some patients can be really helpful. Dr. Rachel Rubin spent a lot of time talking about that during her presentation last time. Pelvic floor physical therapy can be really helpful for folks experiencing pain and tension. And dilator use may be important. And then being mindful of the timing of when engaging in sexual activity or intimacy. And we're going to have a whole slide on that in a little bit. So I want to talk a little bit about sexual desire, because that's probably most often why couples come to see me. Desire is often a top concern, whether it's a lack of desire or it's a desire discrepancy in between couples. And we know from the literature that about 40 to 100% of people diagnosed with cancer will experience some form of sexual dysfunction that may impact their desire. And if one person in the partnership is experiencing issues with desire or dysfunction, that means everyone in the partnership is experiencing it. And like we talked about before, all types of oncology treatments really have the potential to impact sexual health. And desire is one of the factors that's most commonly reported to last for a long time and to be present. So when we think about rebuilding desire, we want to really understand desire. Many couples will notice changes in their sexual desire patterns, and understanding the difference between spontaneous desire, that desire that kind of happens out of nowhere, and responsive desire, the desire that kind of develops and builds in response to some type of stimulation, can be really helpful. And for many couples after cancer, creating the right context for sex and intimacy becomes even more important than before, because there may be other things that have to be managed, like fatigue or pain, or a new attention that needs to be given to emotional safety. And so really understanding desire can be helpful in making sure it doesn't get lost in the shuffle. So I mentioned the two types of desire, spontaneous desire and responsive desire. I like to think of spontaneous desire, and this isn't completely accurate, but the desire that you may have experienced when you first got into a relationship with your partner. So it may have been desire that kind of just like creeped up when you were at work, or you happened the minute you saw them, or really didn't take a lot of effort or work. And really oftentimes could lead very easily into sexual activity. And you use that physical desire as an indication that you wanted to move into physical sexual activity. Whereas responsive desire, you may not have have like that inkling of that like body or physical sensation of I want to have sex. It's more like in your head. Again, I go back to that question of like, why do you want to have sex? That desire is like the why you want to have sex is the desire. So you may not be feeling it in your body. Your mind actually may be telling you, I'm not in the mood for it. I'm tired. I've been responsible for too much. But that psychological desire, I want to have sex because I want to feel close to my partner, or I want to have sex because it's an important part of our relationship. That's that psychological desire. And so you may not feel like the desire physically, but you may initiate sexual activity in the hopes that physical desire will follow it. And so for many people after a cancer diagnosis, and this is true when people are aging or when they're tired because they have kids, that physical desire isn't going to be there. The desire comes more from a psychological desire to want to have sex, and that starts the physical activity. And then it's the physical activity that creates the physical desire. And so for couples who are waiting around perhaps for you to have that physical feeling or that physical desire, you may get frustrated pretty quickly because it may not come. And so there will have to be some navigating and scheduling around, hey, we're going to try to have sex. We're going to start the process of it in hopes that that physical desire will follow behind it. When we think of wanting to do this, I like the dual control model because I think that responsive desire, this idea of needing to cultivate it in your mind and start the act physically before it's there, can really be impacted by this dual control model. And this model states that everyone has, just like a vehicle, brakes and accelerators, and that those impact sexual desire. Now, if you have your foot on the brake and hit the gas, the car's still not going to go. Most of us already have a longer list of brakes and accelerators even before a cancer diagnosis. And those cancer diagnoses can really create a lot of brakes. And that's both for caregivers and those with the diagnosis. And so it's important to really understand what your brakes and accelerators are so that you can try to move as many brakes out of the way and increase as many accelerators as possible. So for some people, a brake may be like a messy house and kids in the house and how tired you are after work. Your accelerators may be really wanting to connect with your partner, how good you feel after you have sex, and clean sheets or something like that, or more time to engage, or dim lights and nice music. And I find that what happens after a cancer diagnosis is that people who've been together for a long time really had a sense of not only what their own brakes and accelerators were, but what their partner's brakes and accelerators were. And they had kind of learned to manage them over the years. And so after a cancer diagnosis, one, it's important for patients to relearn their brakes and accelerators. It's also important for caregivers to do that as well. And then being able to share that can really help both of you move towards a space where the foot can come off the brakes a little bit, the accelerator can go down, and engaging in intimacy and sex can be easier. So as we think about deepening the understanding of sexual desire, there really needs to be some reflection. Really understanding how has the cancer experience impacted your sexual desire. That is just as important for partners as it is for patients. How has role changes impacted it? How has physical changes impacted it? How have the relationship dynamics changed? So really for both of you to understand how the cancer diagnosis has impacted your own sexual desire. It's also important for both of you to know why you want to have sex. You want to reflect on that reason and really connect it to your motivations. It's hard to engage in sexual activity when you're not feeling the physical desire if you don't have a really good reason for why you're doing it. And then you want to talk about this. So you want to write down your brakes and accelerators to know them for yourself, but also to start having conversations about this. Same is true of your why and also of the impacts of the cancer diagnosis. Because I find that oftentimes sexual health conversations happen in people's heads. And we think that our partners are either thinking the same thing as we are, or they know what we're thinking. And so as we start to learn ourselves again, starting to share and talk about these things can be very important. I often find people look to the patient. Oh, well, the patient was impacted by the cancer. So how has your body changed? How have your breaks and accelerators changed? But really, it needs to be both people doing it. One, for it to be impactful and effective, but really it takes two people to have a good sexual experience. And so both people really talking about the impacts to them and the changes are really key to helping to generate desire and coming to a new place of shared understanding. And communication, while the foundation for rebuilding intimacy, can be really scary. When we think about creating a safe space to have these conversations, there's a few things that are really important. One is choosing the right time. So we don't want to have these conversations when one person is overly tired or distracted. Oftentimes I recommend to couples that you schedule these conversations ahead of time and you give your partner a heads up of what you want to talk about. So it could look something like, hey, I've noticed that we haven't been intimate since my cancer diagnosis, or hey, I've noticed we haven't been intimate since your cancer diagnosis. This was something that made me feel really close to you, and I'd love to talk about what it's been like for you. So we want to be mindful that our language doesn't have blame in it, that doesn't create shame, but really just talks about the desire for talking about intimacy and the impact to the relationship. When we talk about active listening, it also really means hearing your partner. I think oftentimes when we have relationships, we want to get our point heard first. And so while our partners are talking, we're coming up with our response without always truly listening. And so really sitting back and knowing that you don't have to respond immediately, but listening to what your partner is bringing to the conversation can be really important. Being really specific about your needs rather than expecting our partners to guess. Regular check-ins. So these aren't just conversations that we have once, but they're important to have a conversation, to repeat the conversation, to come back to the conversation, especially something that is as important as sex. And I just want to hold space for the idea that many of us weren't especially taught how to have conversations around sex. And for those who have been partnered for a long time, if you did have those conversations, they probably happened a long time ago. And some people never had them. They just kind of assumed that everyone had sex the same way and thought about sex the same way, and they kind of got into a groove and started doing it. It worked, and so maybe there wasn't a need to, or maybe you ignored the need to. And the cancer diagnosis really presents this great opportunity to reestablish the norms and what each person is looking for in regards to sex and intimacy. It can be really vulnerable, but it also can create just an incredible opportunity. One communication strategy that can be helpful is this idea of fact, belief, feeling, and need. I'll give some examples about this, but this can be a really great way to not introduce blame and shame into a conversation. It really allows each partner to kind of take ownership of their own experience and create space for further discussion. So I have two examples here. A fact is just that, it's a fact. So it's not really feelings, it's like a very factual statement that nobody could refute. So ever since my diagnosis, you don't touch me anymore. There's no emotion or feeling, it's just a fact, like we're not touching anymore. I think it's because you no longer find me attractive. So that may not be true for the partner, and there's no need to argue or refute it. This is the truth for the person sharing it. So that's their belief. The feeling behind it is it makes me feel unwanted by you and disconnected from you. So that gives some more context, some feeling. And then what's the need? Like, what's the ask? The ask is, I need us to have more frequent touch. So this makes it really clear, like no one's being blamed, like you don't touch me anymore, or you aren't attracted to me anymore. We're not making statements like that, but we're just creating kind of this neutral idea of here's a fact, here's my belief about the fact. This is the story I've been telling myself about it. And this is how it makes me feel. The story does not make me feel good. And this is what I need to change to help with that. And then from this, a conversation can ensue. Like, how are we going to create more frequent touch? Or what has your partner's experience been with this? And so creating the ability to have non-blaming and non-shaming conversation can be so key for sexual health. Some couples do this really great on their own. They're able to really have these conversations and to do this. Other couples may need the help of a therapist or a third party that can kind of help guide them through these conversations. But the fact, belief, feeling, need can be a really helpful technique to use. So this slide really outlines a structured conversation, and sometimes I recommend that folks do these regularly. So maybe they do it as a weekly check-in to start, or maybe as a monthly check-in, and so each partner can share their current experience when it comes to intimacy. So what's feeling difficult, what's feeling hopeful, what each of you are currently willing to try. This conversation can help acknowledge reality while also creating space for possibility. I find that if partners take some time on their own to answer these questions, that when they come in to talk together, it can be less scary because they have some words that they can look at on a page, they've had some time to think about it, and it can be a good conversation starter. So for folks who don't have a lot of experience talking about sex in their relationship, or want to create a way to help them prepare for it and really learn themselves before they do it, the intimacy conversation or this communication exercise can be helpful. There's different types of sex talk as well. We're kind of talking about kitchen table sex talk, and that's really dealing directly with problems and issues. But there's other types of sex talk that can be important when we think about getting back to sexual health. Provocative self-talk can be flirting, it can be texting, it can be leaving little messages around for one another. Again, it's a way to cultivate that responsive desire. In the mid-sex talk, maybe things that you do like making requests or making decisions together. So perhaps in some of those intimate conversations, you've talked about how there's some pain with penetration, but you want to try it. So during kitchen table sex talk, you may talk about what in the mid-sex talk would be helpful. So maybe your partner would say something like, I need you to reassure me that this feels good while it's happening. Or I need to know that you are going to check in with me and ask if it's painful. So really thinking about how you're going to check in with each other during sexual activity that isn't quite kitchen table sex talk, but can help really make decisions together and make sure everyone's feeling comfortable in the moment. Expressing it's hot and making it hotter sex talk. Those can be sex sounds to enhance sexual pleasure. It can be talking about sex after sex. And so for some folks, they're like, oh, we've never had expressing it's hot and making it hotter sex talk. But perhaps that's going to be something new that you want to think about trying. Or maybe you'll say, I've never had kitchen table sex talk. Maybe that's something that you want to try. But there are different ways to kind of talk and engage in talk that can be important and helpful. But really the key message that all of these types of stuff have a time and a place and can be really important for increased intimacy. Finding the right time. So finding the right time can mean all kinds of different things. So we'll go through some of the ideas when we think about finding the right time. Part of it is managing energy. This can be so crucial for intimacy. Many couples can find success with timing intimate connections to energy cycles. So perhaps you always had sex at night, and that is just what you do, and that was part of your sexual script. But what you're finding now is that by the time you get to the evening, everyone's tired. Nobody has the energy, and even if you wanted to engage in sex earlier in the day, It's just not going to work. And so maybe mornings are better, or maybe certain days after treatment are more favorable. But really figuring out, is there a time of day or a time in a treatment cycle or a time, really thinking about that time component and how it can impact those brakes and accelerators. The other idea is this idea of the spoon theory. Like, we all start the day with so many spoons, and that energy is really a limited resource. And so if it is a day where you may have scheduled or decided that you want to have some type of intimacy, being mindful of how you're spending your spoons. So when you get to that moment in the day, you've kept a few of them to be able to engage in some sexual activity. There are position modifications, and we'll talk a little bit about those, that can require less physical exertion and make intimacy possible even during those low energy periods. One of my top recommendation to couples is scheduling sex. I always get the biggest eye roll when I bring this up. And oftentimes I hear from couples, scheduling sex could not be less sexy. But I will tell you, we schedule everything that's a priority. I pretty much live from my calendar, and I imagine many of you are the same. If something's important to us, we put it on our calendar. So if finding time for sex is difficult, it may be worth considering scheduling it. I also like to remind people that oftentimes we scheduled sex in the past, but we didn't call it scheduling. When you scheduled a date night with your partner, or when you scheduled time for the kids to be away so that you could be alone. Those are really methods of scheduling, but maybe it wasn't quite as overt as putting it on the calendar. But if it's been hard to get back to a sexual rhythm, and it's been hard to carve out time, scheduling sex or scheduling moments for intimacy can be really, really helpful and important. Scheduling can also help with desire discrepancy. So if one person wants to have sex more often, or if one person feels like they're always the one having to initiate it, scheduling sex can be helpful for that. But even if you do decide to schedule sex, I always like to tell people it's still okay to say no. Things may change, you may feel differently in the moment. So we always want to leave space to say no when that comes up. And that is oftentimes a rule that I suggest that people agree to ahead of time. But simply having it on the calendar can really help bring it into reality. And if folks decide to say no or decide not to move forward with intimacy or sex, having like a backup intimacy plan. We're going to talk about non-sexual touch in a little bit, but a backup plan may just be cuddling on the couch. It may be going for a walk and holding hands. So just because you don't decide to engage in sexual intimacy, having intimate touch can still be really important. All right, some other tricks and tools for couples to use is foreplay of the mind. And so sometimes when we schedule sex, being able to use this foreplay of the mind can be helpful. Sex starts in your brain. And so reclaiming passion starts with the belief that you need and want to reclaim that passage. So when I think about foreplay of the mind, again, I may think of ideas like sending each other sexy messages, maybe describing a sexy scene to one another. You could listen to erotic books together. You could dance to music in the kitchen. Maybe you're going to dress in that special shirt that your partner likes, or the earrings. And so really thinking about how we're cultivating a mindset to sex together, a mindset for intimacy can be important. And also when we think about foreplay of the mind, we want to think about incorporating sexuality into your daily life. So it's not something that only happens in the bedroom, or it only happens when it pops up on the calendar like I asked you to do, but that it's woven into the fabric of how you do things. So that could look like a kiss before you leave the room together. It could look like creating fantasies in your mind to tell your partner about later, but really using your mind to incorporate thoughts of sex on a more regular basis can really help prime our bodies and help with some of those physical aspects of sex. I also think that folks want to be really mindful about how they're thinking, and how they're thinking about their body and how they're thinking about intimacy and sex. If we're having lots of thoughts like I'm too tired for sex, or I'm too busy for sex, or I have no interest in sex, that is not good messaging for ourselves. We want to replace some of that messaging with ideas like sex revitalizes me. I'm never too busy for sex. I love sex. And this may sound a little silly, and it's like, those aren't true. Sometimes we have to fake it until we make it. We want to be mindful of the messages we're giving ourselves and how we are really trying to incorporate messaging that goes back to our why. So again, going back to this idea, I'm sure you're not here if you're like, I don't want to have sex again. Maybe you're saying, I don't want to have sex again, but my partner wants to have sex. So my why is my partner wants to have sex. That's your why. So if your why is my partner wants to have sex, then as you think about these positive sex messages, they may be like, sex is important for my partner to feel connected to me. Sex helps deepen my relationship. And so really trying to have some positive messages around sex can be really helpful. All right. Relaxation and mindfulness. This is a tool that we recommend to individuals all the time that can really be helpful for couples. And doing mindfulness together can be a great way to create some intimacy. We know that mindfulness helps reduce the stress. We know that stress makes people less likely to engage in sex and intimacy. So thinking of mindfulness really as an accelerator to increase sexual desire. It also teaches us to be in the moment. So rather than thinking about how sex used to be easier or used to be different, or getting lost in what you think your partner is thinking, or thinking about your future to-do list, practicing mindfulness can really help you be present in the moment. And we know that being present in the moment can lead to much more fulfilling sex. So whether you practice mindfulness as de-stress, or you listen to like sexy mindfulness, both of those can be helpful. I also encourage folks to think about grounding exercises before engaging in sexual activity. Certainly these can be done alone, but it can be really special to do these as a partner, to say like, before we're intimate, I want to like bring us both into the moment here together and to kind of calm our energy or calm the nerves. So that could look like starting with massage. It could be doing deep breathing exercises with your foreheads touching together. Maybe you start with a hot shower. Whatever can kind of bring you both into your bodies and both into the moment can be really helpful mindful techniques. Well, I'm realizing I'm going too slow. All right. You want to try new experiences. And I don't just mean new experiences in the bedroom. Novel activities outside of the bedroom lead to increased sexual pleasure. And so trying something new, not knowing if it'll work out or it's going to be a failure, is a lesson that can give you great information. And so thinking about what are fun things that you can do together that are not sexual in nature can actually lead to more sex. And you also want to try new experiences in the bedroom. This can be important too. When you're trying new experiences in the bedroom, there needs to be a lot of laughter and joy involved in them. You may be trying different types of touch, different positions, trying to expand what we call the sexual menu, using new toys, practicing maybe simultaneous self-pleasure together. But really thinking about how you can bring new things into the bedroom that will help elevate some of the other challenges or breaks that you may be confronting as a couple. Really focusing on pleasure. Oftentimes couples get so attached to the outcome, so attached to the orgasm, when there's so much pleasure that can happen before that. And so instead of thinking about getting it done and being efficient, really thinking about what feels good right now. What's it like to have my partner touch me? And I always like to say foreplay starts at the end of the previous orgasm. And so really thinking about how you bring that touch and that pleasure into everyday life can be important. Increasing non-sexual intimacy can also be really important as you work your way back to sexual health. So that would mean emotional and physical connection that's maybe not sexual in nature. So what makes you feel close to your partner? Talking about what makes you feel close to your partner together can be really important, and then do more of that. So if it's holding hands more often, if it's kissing in a non-sexual way, if it's watching TV and cuddling on the couch, you really want to find ways that can enhance that non-sexual intimacy. For a lot of partners, it's really helpful to kind of take sex off the table for non-sexual intimacy, because I find that one of the partners or the other gets really worried that they're either leading their partner on, or it's going to turn into their partner wanting more. And so it can be helpful to set boundaries right up front. Hey, I want to cuddle on the couch tonight and watch this TV show together, but I'm not going to want to have sex. And so making sure that everyone can feel good so that you really can engage in cuddling, can be there without expectations. This really helps to reduce pressure. Pressure is the ultimate killer of intimacy and sex. When people are worried about pressure, they oftentimes pull away. And so really thinking about how you can set boundaries that create less pressure can have a paradoxical effect and lead to more pleasure. So touch as an intervention can be really helpful. One intervention I recommend for folks is to take a day to monitor what type of touch you're getting and giving. So questions you may want to be paying attention to is, how often do you touch? How often are you touched in an affectionate way at all? How often are you touched, or do you touch in a provocative way? How does it make you feel? And so really just getting a baseline. Are you not touching at all? Did something happen with the cancer diagnosis, or even before the diagnosis, where you quit touching each other? If that's the case, we don't want to go from not touching to having sex. We want to introduce some touch back into the relationship. And so knowing how you're touching and what touching is can be an important first step. Then knowing what kind of touch you may want more of can be an important next step. But really trying to incorporate more touching can be very helpful. Sensate focus exercise is another type of touching. It's a technique that was developed specifically for couples who are facing sexual difficulties, and it explores touching without the pressure of sexual. So oftentimes when we prescribe Sensate focus, or we have a couple start Sensate focus, we say, like, no sex, whatever sex means to you. We don't want this to lead to sex. We really want this to be about touching. And so we want folks to be fully present in the moment with the sensations. There could be areas that are no-go. So maybe if someone's had surgery on a breast or a part of their body, you can set rules around what can be touched and what can't be touched. And I put some more kind of guidelines here for Sensate focus exercises. There's also some great books that can be really helpful if you want more detailed descriptions. And if you Google it online, you can usually find some good descriptions too. But this can be a great way, one, for people to relearn their bodies, like having someone else touch you to feel like what pressure feels good, what type of touch and where touch feels good can be helpful. Pleasure mapping exercises can be helpful as well. These can be helpful for partners who are afraid of harming someone, but it also can be helpful for patients to kind of re-explore their body and discover what feels good now. And so I'll give people an outline of a body just like here, and I'll have them color in areas that are okay. So maybe they color their feet green, their hands green, and their nipples green. But they may cover maybe they've had surgery on their stomach, and so they cover that red. And maybe they're not sure how it would feel to have their face touched, so they cover that yellow. And so it gives a really nice map to your partner. Like, what are the areas that are off limits, and what are the areas that I'm willing to try to explore, and what are the areas that, like, yes, 100% go to town on. An intimacy menu can be helpful as well. This helps couples kind of expand their options for connection. So I like to think of it as a restaurant menu where you may have different sections. So the appetizers could be your brief low energy connections. So think like kissing, holding hands. Main courses may be for more involved activities. So that could be a deeper sexual connection. It could be a massage without clothes on. But each, coming together to create this menu can be important. And desserts are maybe for special occasions and connections, or maybe you have dessert every night. But really thinking about what are the different things that you can put in the categories so that it's another way to communicate. Like tonight we can only do appetizers. That's all I have energy for. Or tonight you can pick from anything off the menu. Or tonight you get one thing off of each category. But it helps make sure that partners aren't guessing what will feel good or what people are open to, and really helps, like, as you think of trying new things, what are the things that you've talked about at the kitchen table that you're willing to try in the bedroom or in the coat closet or wherever it is that you decide that you want to engage sexually. Using different sexual positions can also be helpful. You will get these slides, but really thinking about if there's pain in a certain area, how can you use pillows or props, or different ways to hold up your body that will make connecting in this way more feasible. Okay, so what are some of the key takeaways? Focus on pleasure. If I could say nothing else, really getting away from this idea that there needs to be a certain outcome or a certain performance, and that pleasure or connecting is really can be the goal and can signify success. Being playful can be really helpful. Taking time to reflect on recent sexual experiences, that there have been some. Was it success? Was it good? Was it great? Was it just okay? What could be different? And really approaching this from like a non-judgmental way, that you are taking a course with your partner. You all are learning together on what this new life and sex life will look like after a diagnosis. And every sexual encounter doesn't have to be equally pleasurable for each partner. Maybe one night one person is going to get a lot of the focus, and another night someone else is going to get a lot of the focus. I think it can be complicated when only one person is experiencing pleasure all the time, but there doesn't have to be this mandate that everyone has to receive the same amount of pleasure all the time. I did want to take like a special note about working with healthcare providers. I've heard so often from patients, like, I can't get my doctor to talk to me about this, or I'm not able to find the information I need. And I just want to say, one, you're not alone in that. Oftentimes, there's a lot of reasons why providers may not be able to engage in these conversations. It could be based on time. It could be that they don't have the education. It could be that they feel uncomfortable with it themselves. But I do think there's some things that can help you get what you need. One of it is just expressing an openness for the conversation. You may want to prepare questions for your healthcare team and send them ahead of time. There are specialists who specialize in sexual health. So if you're not getting the information you need from one doctor, you could see a sexual medicine specialist, a pelvic floor PT, a therapist. Any of these people can help you get the information that would be helpful to you and help design some of those questions. Don't be afraid to advocate for your sexual health needs. Even if you're getting messaging that tells you otherwise, like as a couple going in and saying, this is something that's really important to us and we need some help figuring it out, to really advocate for what's important. And then go into these appointments together. So sexual health shouldn't be just one person's responsibility. So it's not just the responsibility of the person with the cancer, and it's certainly not just the responsibility of the caregiver or partner. And so really thinking of sexual health as a team sport and how you can do it together is really important. So just as a reminder that you're not alone in these challenges. These are incredibly common. There is no right way to reclaim intimacy. So I can't tell you exactly what to do, but I can tell you that the patients I've worked with and the couples I've worked with who have had the most success are the ones that are most willing to try new things and try to create fun to it. They don't view it as like homework or more work, although that certainly creeps in. They try to make it really playful and say like, what are we going to try this week? Or what can we do differently this week? Knowing that there's not going to be one magic wand. And oftentimes it takes a lot of little steps before you notice a difference, but something that they've decided is a priority and that they want to work on, and that they want to bring some playfulness to. Communication is really the foundation of reconnection. It's really hard to do any of these exercises or move forward with sexual health if you can't communicate about it. So really kind of leaning into the uncomfortableness of communication and creating the opportunity to communicate is one of the first, most important steps, and the steps that you have to come back to over and over again. Don't be afraid to reach out to professionals. Finding a sex therapist can be really helpful. And knowing that healing happens at its own pace. So there's going to be times when you're feeling like, yes, I got that. It's really great. And other times that you both are going to be pulled back and it's going to feel like you're not making as much momentum as you want. But really just thinking about how do you keep moving forward and take these slow next steps. And oftentimes people turn around and they can say, you know, our sex life looks really different than it looked before, but we're more deeply connected and it's more meaningful. And you know, we're at a place that we feel really good about it. So that is where I'm going to stop, and I would love to answer some questions for folks.
Jen, can you see the chat?
I can. Okay. So given the hormonal impact of birth control and exploring non-hormonal types, does anyone have experience with sex? Condoms ain't cutting it, and we really don't want to get pregnant. So I can't speak to that specific non-hormonal birth control, but I think that could be an incredible thing to talk to your gynecologist about, or really connect your oncologist and gynecologist to see what other birth control options you have available to you. And then there are female condoms that for some people feel better and different than male condoms. So that could be something worth trying. Using non-penetrative sex could be another option. But I do think reaching out to your gynecologist and your oncologist, seeing if there can be some connection there to figure out the birth control method that could work both best for not getting pregnant and experiencing pleasure. Do I have any recommendations for podcasts to listen to, and a couple that could help support this topic, or erotic audiobooks focused on queer sex? I had a resource slide that I can't find. Becca, you have some? Yeah, go.
I'll send it out tomorrow. I have a list at the office. Yeah, okay. I put some in there that the pleasure mechanics is speaking of sex and sexology are two really good podcasts, but I will get that list out as well.
Great. And there is a great list. We'll make sure it's on the resources of erotic audiobooks. And I do believe that they are categorized where you could find queer sex as one of the categories. I'm not 100% positive, but we'll check on that and we can add any of that to the resource list. All right, we're getting thumbs up for book recommendations and podcasts. Someone mentioned that they feel comfortable that all these feelings about sex are normal. Yes, yes, yes. Because sex is so taboo and because it's not talked about enough, people can often feel really isolated and really lonely with this. And so knowing that you're not special, you're all very special, but you're not special. Like everyone has their sexual health impact. This is It's really impossible to get through a cancer diagnosis without having some impact. And everyone's journey to getting back to sexual health may look very different, but it is normal, and really kind of building your own roadmap with the different tools that folks can help you with can be really important. Any other questions that folks have? Okay, if I could give you a takeaway, if I could give you homework, we always say like, oh, these are great ideas. I'm going to get to this next week. I'm going to get to this next month, or I just need to get this next thing off my plate. Pick one of the tools, whether it's creating like a fact, belief, feeling statement to tell your partner, or whether it's then say focus, or it's setting aside 10 minutes for a conversation. Pick one of the tools we talked about today and try it in the next 3 days. You don't have to go crazy, but taking that first next step can sometimes kind of get the momentum going. All right, thank you all for coming. I hope you take away something that will be helpful to you. And then I hope you'll join us on June 3rd for our final presentation in this series. And of course, if you missed any, all of the presentations have just been phenomenal and so full of great information. Check them out on our YouTube page and get all caught up. Thank you all.